More employees than ever are experiencing burnout, anxiety, and mental fatigue. The COVID 19 pandemic magnified an already growing crisis: mental health in the workplace. But what if occupational therapy could be part of the solution? Every year, nearly 1 in 5 adults in the US experience a mental health condition. But in the workplace, the numbers tell an even darker story. According to the World Health Organization, depression and anxiety cost the global economy over $1 trillion in lost productivity every single year. In a recent survey, over 76% of US workers reported at least one symptom of burnout. And yet, only a fraction receive the support they need. Behind every statistic is a person, someone quietly drowning in deadlines, expectations, and unrelenting stress. The workplace is becoming a mental health battlefield, and occupational therapy might be one of the best kept secrets in the fight to reclaim balance and well being.
As a lawyer in the corporate consulting space, we are constantly pressured to deliver at the highest levels. With high performing clients, the expectation is high quality deliverables. And so this comes with a lot of added stress, uncertainty, and long hours. There are days where we're in the office for 12, 13 hours. We don't get home until 9 or 10 p.m. And not only is the time that we spend in the office and in meetings mentally exhausting, but the time away from the office can become equally as exhausting as we're carrying our work around wherever we go, whether that's on our laptops or on our phones. And so, even after those long 12-hour days, I could still get a message on my phone, which would require me to think further about work. And this makes it a little bit more difficult to separate work life from home life. And although the firm that I work with is pretty supportive about maintaining a healthy work life balance, it doesn't necessarily always play out that way in the real world. When the expectations are as high as they are, it's not always easy to just take a mental break. And so I think this definitely leads a lot of people in my profession to just burn out or suffer from anxiety. And if the corporate world were a little bit more open to providing mental health services or mental health breaks, I think it would do a lot of good. If such services were offered to me, I would certainly take advantage, and I think it would lead to a lot of positive outcomes both in and out of the office.
I think OT is super well positioned to address mental health in the workplace because we, focus on occupations, and we know that work and employment is such a meaningful occupation, and we specifically kind of know what are the kind of the mental functions that exist around that occupation. And so, us as OTs, we are in a very unique position and role to be a consultant, working with other employers in order to kind of address mental health in the workplace, whether it's through kind of wellness programs, wellness initiatives, or also it's whether kind of restructuring the environment, looking to see how we work in the day to day, how we do our our routines and our habits and our day to day kind of jobs.
Mental health challenges affect employees across every sector, but some communities are more at risk than others. Women, workers of color, and those with disabilities often face greater barriers to care, fewer accommodations, and more stigma.
I work as a physician assistant in pediatric surgery and can often be overwhelmed by my job. I see about 20 to 25 patients each day, and with each patient comes a entire family with multiple questions and concerns to be addressed. As we're providing education and making the best medical or surgical decisions for this patient, it is a lot to navigate, especially over the sounds of crying children or multiple siblings running around the room. By the end of the day, I feel quite depleted from the many conversations that we've had, but then still have all the notes to be charting on, as well as an inbox full of patient messages or staff messages, pharmacy requests, or lab results to review. I'm often bringing home work or working through time during lunch just to stay on top of the tasks at hand. I would absolutely appreciate resources for wellness, as well as time to utilize those said resources throughout the day to allow myself to be the best version of both myself and the best PA possible to do my job well.
So something that I cover in the beginning of my summer course is this concept of what's called micro self-care. And essentially, this was originated by a social worker. Her name is Ashley Bush Davis. And she considers self-care in terms of macro, in terms of these big things that we usually think of self-care, right? Taking a big bath, going for a massage, going to the gym even for like an hour or so, right? These things that require usually like a lot of time, effort, and money. However, she recommends also looking at what's called micro self-care. So looking at these like everyday small little acts of self-care that takes like no more than like 1 minute or two that you can do throughout your work routine, throughout your work day, whether it's like right before you're seeing clients. For me, sometimes I do it while I'm seeing clients in person or through telehealth.
Mental health in the workplace isn't a luxury, it's a necessity. Employers can take real steps, encourage open conversations, offer mental health days, design supportive spaces, and bring in occupational therapy to guide sustainable change. Because when people feel safe, supported, and seen, everyone wins.